Welcome back to Virginia This Morning.
This Partners in Healthcare segment is sponsored by Hopewell Healthcare Center.
They've become a part of the community, supporting families and future residents along the way. Lindsay Reynolds and June McCullum with Hopewell Healthcare Center join us this morning. Thanks for coming in, ladies.
Hi, thanks for having us.
Hopewell is a beautiful community, and it definitely has that neighborhood feel. People know each other there. It's nice to have a facility that embraces that spirit of community.
Yep.
It is.
We are a 130-bed facility. We have inpatient physical, occupational, and speech therapy. And like you said, we are very community-driven. Both our medical director and assistant medical director are local physicians in our community.
And Hopewell Healthcare Center works to do different initiatives in the community too, so that you have the opportunity to meet families and meet potential patients and interact quite a bit as well.
Right. We really like to give back to our community. We have really strong relationships with the local churches, the senior living groups, the different organizations in the community. We go out and visit them every month and do free blood pressure and blood sugar screenings, as well as do talks to them in the community about health-related issues.
Now, Lindsay, you work with the marketing team, and June, you've been a part of the group there starting many, many years ago.
Yes.
You're a registered nurse. Tell me about your journey starting there and now making your way back.
Well, in the early 80s, I was actually the director of nursing at then called Hopewell Convalescent Center, now called Hopewell Healthcare Center. And some of the nurses that I work with now were nurses that I worked with for a long time in the past. So we have gathered together and formed one of the best nursing staffs that I've been affiliated with.
I think it's a really fantastic story that you've continued to work together, and now you've returned back to the Hopewell Healthcare Center and really have a great team there.
Yes.
Now, you guys take a little bit of a different approach, starting to work to make sure if people are able to make it home, that they do that. Tell me about the Next Step Home program, Lindsay.
Well, it was created for short-term patients as well as their families, and it's really setting up goals for them to get home successfully and safely. And it starts when they are in the hospital before they even come to us. Our clinical liaison, June, goes out and does a pre-assessment and just sees where they were before they came to the hospital. And then once they come to us, we have a meeting with them and their families within the first 3 days with key members of our staff, and we talk about their goals while they're there, as well as where they need to be when they get home.
I would imagine families really appreciate this kind of attention to detail, because oftentimes, unless you've been there before, you don't really know what to expect. You don't really know what to anticipate. How do families react to that kind of care?
Well, they're very, very positive about it, especially with the visits that we do in the acute medical center, and then just the interest in what they expect and what their expectations are, what they need to return back home, and that's their goal.
And June, tell me, as a clinical liaison, and you mentioned sometimes you share an association with patients and you are able to build a different relationship of trust.
Oh, yes. Jessica, I guess if I had to pick a job at this time in my nursing career, this is the top rated job of all, because here as a clinical liaison I can be a patient advocate, and I can also tell people what a wonderful facility that Hopewell Healthcare is, and I get to explain all the many programs that we have in rehabilitation, the great nursing staff, activities, and then I get to meet the patient and find out what their goals are. So that individual interest is what I think makes a difference.
And do people know the right questions to ask when they start to explore this as an option?
Generally not, and that's one of my jobs as I go to visit them, because they're usually frightened about, you know, the stigma of a nursing home in the past years, and they are very relieved to find out that this is a short-term, rehabilitative, meet your medical needs, get you back to the community, let you go home as soon as possible, and that's encouraging to them.
Have you found that when you're interacting in the community that you do end up meeting folks that come in and need the services, and then they're very glad to have made that association before it was ever necessary?
Yes, we do. We actually had an event in our facility in February, a rehab reunion, and it's where people who had finished rehab and gone home could come back and kind of mingle with each other. And some of them brought their neighbors and their friends, and actually we had one that actually came back to us So it was a really great chance to meet other people and offer them our services.
I think the Next Step Home program is just really fantastic in that, you know, it sets people up from the get-go. They know what to expect.
Yes, yes. Even when they're admitted to our facility, after all of the matches, we do a match between their medical needs and our resources. And if that's a match and they come into our facility, then I follow them as part of my job, and I visit them regularly so that I can keep the goals, you know, and encourage them toward the goals and get them over some rough spots, and you know, a lot of times just be a listening ear for what they're dealing with, because it's oftentimes hard for a senior to deal with health problems like that.
I have a funny feeling you keep them right on track, June.
Well, we try.
Well, thanks so much, ladies, for coming in, and we'll let everybody know how to get in touch with you.
Thank you.
Okay, thank you.
Connect with Hopewell Healthcare Center, one of your partners in healthcare, by visiting the center at 905 Cousins Avenue in Hopewell, or you can visit online, carevirginia.com/Hopewell, or give them a call, 458-6325.